Hi, I'm Dr. Rob Cushman, the Acting Medical Officer of Health for the Renfrew County and District Health Unit. I just want to update you on what's been going on in the county and district. Unfortunately, things are not good. Wave 3 and the variants have really taken a hold in our county. April was our worst month. We had almost 160 cases. We'd never been above 100 before that. So you can see what's happening. And what's really concerning is that we're seeing it continue into May. The first week of May was marginally better, but the second week, which we're in now, is just, I think we're already beyond 25 cases at midweek. So this is not good. Wave 3 and the variant has really taken a hold. We're actually looking worse in Renfrew County than elsewhere in the province because our numbers are going up, while other numbers in the province have started to go down. Now, maybe that's just because there's a lag time. But there's one thing that we've noticed, and we've seen this like we've never seen it before, and that is how many workplaces we have had in outbreak, not only now, but in the past 6 weeks. Really, the bulk of our sites have been workplaces, and this is not good. And that's what I want to talk to you about today. And we see what happens when the variant gets into one of these small workplaces. Someone brings it in, they infect a lot of people. Amongst those people, they take it home. A spouse gets infected, goes to another work site. A child gets infected, goes to a daycare center. So we've seen real multiplier effects here. And what I think we're seeing is that workplaces are really not paying enough attention to the public health guidelines in terms of staying home if you're unwell, in terms of masking and distancing and hygiene. And it's very important. And equally at work sites, we've noticed that there may be problems at work, during work, but worse is what goes on during lunch hour and during breaks, and maybe even socializing with your colleagues in off hours. And this really has to stop. Unfortunately, as I said, it's never been as bad as it is in Renfrew County. And while the vaccines are approaching 50% this week, we need to do more if we're going to keep wave 3 and the variants at bay, and if we're going to allow the vaccines to take hold. Another problem with the work sites is these folks, by and large, are much younger and working, and so they don't have chronic illness, and they haven't been vaccinated. And equally, there may be a problem where if you don't work, you don't get paid. But you know what? If you come down with COVID, and if you bring COVID into your workplace, the place is going to shut down for 3 weeks. So it's a lot worse for not only you, but also your colleagues if that happens. Much better to take time off immediately to get tested. And if you're negative, you go back to work. If not, you take 2 weeks off. But that's a lot better than taking 3 to 4 weeks off and closing down the entire work site, and also being involved in the transmission of COVID variants to other work sites, daycares, and other families. So it's really important that we see to this. And we've seen in some of these small work sites where more than 50% of the employees get infected. We've seen it time and time again. I can't tell you, these are very wily viruses, these variants, and they will infect anybody and everybody. And not only that, we're seeing younger people get sicker, we're seeing younger people in the ICUs, and we're seeing deaths in younger people. So it's extremely important that you keep every effort you can, keep it up to make sure that we control these variants. And sure enough, if you do this, by the middle of June, a month from now, we will have kept wave 3 at bay. We will have a vaccine rate, not only for first shots, probably around 70, 75%, but also we will be starting to vaccinate people a second time. And you know what? If we do that, we can preserve summer. So we have a sheet for you, which I'll have shown on the screen here. And basically it says, don't let down your guard. It's imperative that you keep it up. If you're unwell, stay home. If you are in contact with someone, not at your work site, that has COVID, make sure you get tested. Phone VTAC, get tested. Wear a mask, always when you're indoors, even when you're outside if you're close to someone. And keep those 2 meters. It's really important to keep 2 meters apart. It's essential. It works outside, but it's even more important inside. And most of all, keep your grouping to a minimum. Household contacts at home. When you're at work, be very careful. Just stick to the work. Don't socialize in the off-work hours. And even when you're working with someone, pay attention to the precautions. It's extremely important. And also just general cleanliness in terms of shared items, very important. Food items are even worse than work items. So please pay attention. So just to wrap up, we've seen a lot of problems in work sites. That's where most of the disease is currently. And I know everyone's fed up, but we can do this. Keep your guard up. We need another month to get the vaccine level up and to get the wave 3 with the variants in tow so we can look forward to a good summer. And we all need one. Thank you very much.